affordable, high-quality healthcare. Sounds crazy, right?
Well, it's not. But to make it possible, we had to restructure how healthcare works to remove the unnecessary administration, waste, and inefficiency that are driving up costs in the current system. That way you only pay for the healthcare you actually need.
I know what you're thinking. If we figured it out, why isn't anyone else doing it?
Unfortunately, today's healthcare system is working against change. But a lot of us in the industry have spent years trying to develop a solution to make healthcare easier and more affordable. Hopefully, Redirect Health is just the first to offer a solution that actually starts working for business.
By the way, we welcome competition because that would mean the industry is starting to change for the better. We just want to make healthcare work the way it should.
You see, the system is built to maintain the status quo. Our $3 trillion healthcare industry isn't just made up of healthcare. At least 2/3 of it is waste and administration. And let's not forget this is all revenue for someone, usually multiple someones.
Redirect Health, on the other hand, just wants to provide practical, common-sense options that work for businesses, their employers, and their families. In fact, David originally built the first version of this system back in 2007 for our own team at Arrowhead Health Centers. Before we created this new model, we tried to work with a lot of different traditional insurance companies, but the costs were always too high. We noticed that we were losing some of our best team members to other companies that could provide better health insurance. It cost so much money trying to recruit and train new staff, money our business didn't have.
So we decided to self-insure, to sponsor our own plan, because we thought we could do it better. But when we got our employees' medical bills, we noticed that the costs were all over the board. Writing our own checks for healthcare showed us the exorbitant price differentials that existed. There was just so much overpricing in the system. So we decided to use our own experience as doctors to get fair prices for our company and our people. We found that our method worked so much better than what was standard for everyone. Without paying for unnecessary waste and administration, our employees and their families were very happy, even relieved, because they actually received more healthcare with higher quality and they paid so much less out of pocket.
Eventually, we realized our system could work for any business. In fact, David began to help his friends' businesses do the same, just for fun. After seeing so many business owners thrive in the plan we designed, we decided to start Redirect Health.
Here's how we make it work. First, we reduce the need for going to the doctor by providing a phone number that your employees can call 24/7 in English or Spanish. When your employees call Redirect Health, they'll get all the attention and answers they need right away, 24/7. If it can't be done over the phone, we'll schedule an appointment for them exactly where it makes most sense. And most importantly, we'll organize a care plan and make sure it's passed on to their doctor's office or hospital well before they get there, so everyone's prepared. No more telling their story over and over again if they don't have to. We think it just makes sense. And it sure does save a lot of time, money, and hassle that none of us like or appreciate.
We designed our plans for businesses of all sizes. Unlike traditional insurance companies, we don't offer huge discounts to large companies, forcing the smaller businesses to foot the bill. Everyone gets the same affordable care.
But here's the biggest problem Redirect Health eliminated. We separated healthcare from health insurance. Confused? Don't worry. Most people are when they hear that for the first time. People think they need insurance to get routine healthcare. They don't. But occasionally, you may need catastrophic care, which is where insurance can be really helpful.
But by separating the routine care from the catastrophic, you're no longer paying for something you may never use. You can always add the coverage you need back in and customize your plan for your particular needs. No more paying for things you don't want or need, just so you can get the coverage you actually do need.
We've made healthcare affordable by cutting the waste and focusing on companies and their people, instead of administration. We've developed an alternative to traditional health plans that is both more efficient and affordable. With Redirect Health, you get to choose what's right for you, your business, and your employees, not what's best for the system.